Hey there, it's your girl Laura Williamson. Welcome back. This is Bear Fitness, and I am your host. I am a Pilates instructor, a personal trainer, and health coach extraordinaire. So today is going to be an exciting day. I have another guest with me today. And here's the thing. What we're going to talk about today is you're not ready for this, but you will be. We're going to talk about pelvic floor health with my guest, Stefanie DePaul from Boston Health and Wellness. And Stefanie, hi.
Hi.
Thank you. Welcome. I'm so glad you're here today.
I am so happy to be here. Thank you.
Yeah, I love it when other people come and visit me. And so I'm ready for you. I'm excited. I got questions.
Great.
Honestly, clients have been talking to me about this very thing for quite some time now. And honestly, you are like gold right now. You are fine. And I tell you why, because it doesn't seem to be something, it comes up in conversation as a personal trainer, but it's my understanding that there's a lot of difficulty around this particular topic and getting help. So I'm hoping that today's episode can help someone who's been thinking about this or needing to do something about their particular situation or had questions and just didn't know who to go to. Great. So you guys, again, you're in for a treat, and I'm going to jump right in.
Great. Let's jump right in.
Okay,
I'm so excited.
Okay, just tell us about yourself.
Great. So my name is Stefanie DePaul. I am a doctor of physical therapy. I'm a certified strength and conditioning specialist. I'm a registered yoga teacher and also a running coach.
Okay.
I live here in Stoneham, Massachusetts, one town over. I also own a business called Boston Health and Wellness, which is also in Stoneham, Massachusetts. We specialize in orthopedic, sports, and pelvic floor physical therapy over there. I am married to my wonderful husband, James. We have 3 sons. I have a son named Christian. He is 1. I have a 5-month-old named David, and I have a wonderful stepson named Sam, who is in 10th grade and 15 years old. We also have 2 wonderful dogs, Samuel Adams and Paul Revere, who Samuel Adams comes to work with me at our office.
I've met Samuel Adams.
Yes.
He's quite awesome.
Yes,
actually.
he is. He is our therapy dog. So he is also at our location in Stoneham.
Okay. So now, here we go. It's happening. It's starting right now. Give us a little information. How many years have you been in the business? How did you start? How did you get here?
Yeah. So I graduated from UMass Amherst with my bachelor's in kinesiology in 2007. And then I fell in love with physical therapy. I went to Northeastern for my doctorate degree, graduated in 2012. So it is 2023, right? At the end of 2023. So, it's been about 11 and a half years. So I've been doing this 11 and a half years as a doctor of physical therapy. But I did work in the business for 5 years prior to that. So I guess I've been doing this for about 15 years. I've been in the physical therapy field, whether it be physical therapy, personal training, basically working with the human body and movement. It's been interesting for me.
Okay, so you and we met several years ago, and for those of you who don't know, literally she's my neighbor. She's up the street from my studio.
That's right.
And so, I mean, that's kind of how we met. And actually, you introduced yourself to me. You sent me an email and you reached out and you were like, "Hi, kind of, I'm here. I'm in the neighborhood.
That's right.
Would love to meet." And so, since then, we've been chatting and we see each other, and we've kind of stayed in touch and had a couple of conversations. But more importantly, again, I'm ready to dive into the topic here. But again, I want them to know who you are and get to know you, because what you do is so very important. And because you are a physical therapist, but you just have so many other things that you are doing in addition to. No 2 physical therapists are the same, as well as trainers. So I just we're emphasizing this particular aspect because you do other things. But in particular, I'm finding that there is a need, especially where I've worked with many women who have had children. And,
that's right.
And I find that has been an issue that has popped up. And what I will ask you next is why the pelvic floor? I mean, I know the questions I'm hearing, but again, it seems that it's a rare find, someone such as yourself who actually specializes in this. So why and how?
Yeah, so I didn't start with the pelvic floor. I started as orthopedic in sports. You know, when you go to PT school, most people go in that direction. They want to work with athletes, they want to work with sports, right? But, you know, being in the business and working with the patient population I have for years, it's great. I still do orthopedics and sports. However, there is a need for the pelvic floor. You know, it's very up and coming. It's an area that nobody really talked about for a long time. And now people are really starting to talk about it. Like, let's talk about the pelvic floor. And that's what we're here to do today, is bring awareness to it. So I, you know, decided I wanted to specialize in pelvic floor physical therapy around the time when I got pregnant for my first child, Christian. He's almost 2 years old. And, you know, with pregnancy and childbirth and the weight of the baby on the muscles of the pelvic floor and girdle, you know, it causes strain to the muscles, it causes weakness, and it causes all different dysfunction to the pelvic floor that people don't really know why it's happening, how it's happening. So shortly after I gave birth to Christian, who had a 99 percentile head, may I add, created some trauma to my pelvic floor. I said, you know, I need to learn how to deal with this, how to fix this, and how to help other women deal with this. So I became certified. We now specialize in it. I now have 5 doctors at my office that specialize in it. We're open Monday through Saturday. We take insurance. It's great. So we are spreading awareness, and we're making it more accessible to the population, especially in this area.
So who are your patients? What's your demographic right now? Who do you primarily work with?
So primarily, I mean, well, we work with all populations. We work ages 5 years old, so children we even work with, till 100 years old. We're not really under the age of 5. That's more early intervention in pediatrics. We're 5 to 100, men, women, and children we would work with. Primarily, our, you know, the most common patient is a woman prenatal or postpartum or pregnant. So they call that perinatal, around having a baby. But we do also treat men and children as well at our office.
So we won't go too deep into that, but as soon as I hear children and men, I immediately think, is that something that is a concern for men also?
It is a concern for men. Men have almost the same anatomy in their pelvic floor, with an exception of a few muscles and a few different organs down there, which we will dive into a deeper anatomy lesson in our second segment later.
All right. So we'll get deep, like you said.
Literally.
All right. Now, so my next question to you is, what exactly does it mean to have a healthy pelvic floor?
So having a healthy pelvic floor means a pelvic floor that is not too weak and not too tight. It's just right. So think of like Goldilocks, right? Not too hot, not too cold, just right. So same thing with your pelvic floor. You don't want it to be too weak or too tight. You want it slightly in the middle. So there's different symptoms associated with pelvic floor weakness. There's certain symptoms associated with pelvic floor tightness. So people will come in for weakness and say, when I run, jump, cough, sneeze, laugh, or go on a trampoline, I pee a little bit in my pants. You know, nobody really talks about that. It's embarrassing, right? Like, but it happens, like, very commonly. A lot of my older patients, older women say, you know, when I had kids back in the day, this wasn't even a topic. No one even talked about it. You had kids and then you peed in your pants, and that was just normal. But that is not normal. It is common, but it is not normal. So we are here to teach you how to strengthen your pelvic floor. There are muscles down there that can prevent any leakage and any incontinence. And then there's also symptoms of tightness that can happen with your pelvic floor. So some of the symptoms would be pelvic pain, pain with intercourse, pain with urination, tailbone pain, difficulty sitting on a hard seat, or difficulty having a pelvic exam. All of that would be painful. So that's associated with tightness. So to have a healthy pelvic floor, you're in between. You're nor weak nor tight.
So what's the likelihood of people walking around not even realizing that there's probably something that they need to work on? It's just they've just been living life and they just accepted it and realized that that's the. I mean, how common is that? How common of an issue is this?
Almost every single patient I see will say, you know, I just thought I was different than the other girls or the other guys or whatever. You know, I just thought it was normal to have pain in my pelvic region. I didn't understand how people didn't have pain there. I just thought this was normal, you know. So it's interesting how it's not talked about. It's not really a topic, and that's why we're here today, is to bring awareness to the pelvic floor. What is the pelvic floor? What are the symptoms of the pelvic floor? Yeah, I think this is great.
I'm okay. Again, very excited. All right, now on a day-to-day, what should I do to maintain a healthy pelvic floor? Like, I'm just living life.
Just like general rules.
Just general rules.
Sure. I can give you a couple things.
Okay.
So generally, people, so when we're trained as, you know, young children, our parents will say, oh, we're going in the car, like go and try to use the bathroom, you know, like go try.
Okay.
You're never supposed to go try. You're not supposed to force it. You're not supposed to push out urination. You're not, that strains your pelvic floor. That actually messes with the way the pelvic floor functions.
Really?
The muscles and Bradley's loop, which is a neurological function of how you release your bladder. So you're jicking, that's called just in case peeing. You're not supposed to just in case pee. You're only supposed to go to the bathroom when you actually have to go. You should be able to sit there and count to 10, and that means you are fully emptying your bladder every single time. That is my first thing. Do not just in case pee. My second thing would be when you go to the bathroom, do not push and force it out. Like if you're like, I'm in a rush, the baby's crying, or I'm at work and I'm trying to get in and get out, and you push, that actually is not good for your pelvic floor either. You're supposed to sit and take deep breaths and just let the pee come out. The third thing you can do is there's people that go to the bathroom and hover. There's more. There's so many more. Don't hover. Don't be that person that hovers and sprays all over the seats. You're supposed to sit firmly on the seats, men and women, and just fully release your bladder. And then staying fully hydrated is another really general, easy one to say as a tip. So these are just 4 simple things you can do.
These are 4 simple things I didn't know and I wouldn't think of, because as a kid, that was one of the things. If we had to go somewhere, hurry up, use the bathroom. Do you have to go? I don't know. And then you go and try.
Go try.
Right. Okay.
Don't do that.
I think a lot of us grew up with that idea.
It's totally right.
That's not new. And I mean, okay, so you're gonna show us everything. You're gonna show us. You're gonna give us full explanation.
I'll give you the anatomy lesson. Yeah.
Okay. Oh, so how about we do this? We're gonna get ready.
Okay. Great.
And then we're gonna just pull everything in here. I'm looking around. You see me looking around. And let me see. And then let me see. We got a little bit of advice, and I think for now, let's just do this. Let's go get your model.
Okay.
And let's show them some of the stuff.
Pelvic floor 101.
Yeah. I think that would be awesome.
Cool. Let's do it.
Okay, cool.
Hello. Hey. Welcome. Come on in. Welcome to the office. This is Boston Health and Wellness. We're located in Stoneham, Massachusetts. We are physical therapy. Primarily, we do sports, orthopedics, and pelvic floor physical therapy here. So this is our main treatment area. As you can see, it's a big open concept. Very homey, it's quaint. It doesn't feel like a sterile doctor's office, and that's what our niche is. We want you to come in and feel warm and welcome like you're coming home to your living room. You can take your shoes off here. We show our staff on the wall so you can see who you're working with. Usually you're with the same therapist. We have 5 doctors on staff. We have 2 licensed therapy assistants, a bunch of physical therapy aides, a massage therapist, meditation specialist, all sorts of health and wellness all under one roof. So come on in, let me show you around. So we have our front desk here. This is where you check in. This is our waiting area, which rarely gets used, usually only on the first day. This is Samuel Adams. Here's our therapy dog. Our PT puppy, who is here every day to greet you at the door when you come in. We have 9 treatment tables in our main room. So it's an open concept. So you have enough space in between each other. There's plenty of room for physical therapy exercises, manual therapy with your doctor of physical therapy. So if you come on through here, you can see we do a daily trivia question to try to keep it fun and light in here. We do decorate for the holidays. We have a skeleton that we dress up for every holiday. We usually have a fun movie on the TV. And then we have some documentation stations here for the medical notes. And then if you come out of the treatment area, you can step into our performance side. So this is our turf area. This is where most of the exercises get done for our physical therapy patients. We also do a little bit of personal training here as well and have fitness classes. Fit for Mom here. We have a little bit of yoga here as well on the weekends. So we have some equipment here for our patients, bikes, sleds, cable columns, but there's a lot more room for fun activities in this room. Lots of exercises can be done in here. We have BOSUs, TRX, physio balls, med balls. So this is a nice open area for classes, exercises, and then we have a private room for our private patients that need one-on-one consultation. So usually your initial evaluation would be with a doctor back here. We also do women's health, so that happens back here as well. Private treatment room. There's a couple of my marathons on the wall. Also some newborn baby photos of my children over here on the wall as well. Yeah, a couple of my Bostons over there. Yep, these are my kids. There's Christian and David. Obviously we go through the female and male anatomy back here, and we have a palm tree to keep it calm as well. So this is the back pelvic floor private room. And then we have a little break room over here, a documentation station here that is a high-low desk that goes up and down, so you can stand or sit and do your notes. Sort of step away from the floor, you have a little bit of privacy, it's a little bit quieter back here. And then we have our lounge back here, it keeps going. So if you come out here, we have meetings, or if you need a minute to yourself, there's an area back here. There are 3 men's bathrooms, there's 3 women's bathrooms. They're very nice. There's products in there. There's lotions, soaps, sprays, hair ties, feminine products, all in the bathrooms with plants and nice stuff. And then it wraps around, and there's a private massage room on the other side as well. Now we're gonna see our massage therapy room. So it's kind of tucked away and hidden back here. This can also double as our second pelvic floor room if that other private room is being used. You come back here, and it's a little bit more zen. It's calm, it's very inviting. There's usually soft music playing, the oil diffuser is on, and it's just, you can't hear any noise from this area. It's even with a full office of patients, it's still very quiet out here. So we like having the massage therapy room out here so you can get PT in the main room, and then you can book a massage after. We do 30-minute mini sessions, 60, 90, and 120 minutes. Deep tissue, therapeutic, prenatal, all sorts of massage, great treatment to add on top of your physical therapy service.
I'm just looking at her.
Yeah.
Please tell us, what kind of model do we have here with us
Sure.
right now?
So most people that come into my office, they'll say, I don't even know what the pelvic floor is.
Mm-hmm.
My doctor told me to come here, and I'm here.
Mm-hmm.
I don't really know why. And I love those patients because this gives me like the open platform to just go for it. So that's what I'm going to do here today with you.
Okay.
So people will say, I don't know what the pelvic floor is, right? Mm-hmm. So this is your bony pelvis, right? So the bones of the hips is your pelvis. Anything that is white is your bony pelvis.
Okay.
Anything that is red is your pelvic floor. It is the muscular hammock or sling. It kind of looks like a hammock, right?
Okay.
Or a sling of the pelvis. If you didn't have your muscular hammock or sling, all of your major organs, would just fall right out, right? Just like that, right? So if they wouldn't fall on the floor, they would sort of hang out, but they wouldn't be withheld within your pelvic girdle, if you will. This is your pelvic floor, all of the red. So if anybody ever asks you that, it's the muscular hammock or sling of the pelvis, okay? So inside your pelvic floor, you have a lot of major organs, okay? You have your rectum, which is the end of your large intestine that sits in the back. Mm-hmm. You have this is a female pelvic floor, your uterus and cervix that sits in the middle, and then you have your bladder that sits in the front, okay? So I'm going to prop this on here. Your bladder, when it's healthy, it's pink and smooth. It looks like bubblegum or silly putty on the inside. When it's overactive or irritated, it looks like it's red and chewed up and on fire and mad at you. Mm-hmm. Bladder irritants are carbonated beverages, spicy foods, alcohol, citrus, and caffeine. All of those irritate your bladder and make you feel like you have to go when you actually don't have to go.
How do we know if it's not this lovely color?
Yeah, you'll feel symptoms. You'll have pain, you'll have urgency, you'll feel like you need to go to the bathroom. You'll sit there and you'll only pee for a second or two. You won't have those full 10 seconds like we talked about earlier, where you actually can count to 10 while going to the bathroom. And that means you have a healthy bladder and you actually had to go. When you drink water through your mouth, your bladder fills with fluid. When it gets to about 200 cc's, you get the first signal to your brain of, I have to go. You're actually not supposed to go. You're supposed to wait until you really have to go. Until you get to about 400 cc's of fluid. And that means you actually have to go. You're supposed to go to the bathroom, not jicking or just in case peeing. Wait till you actually have to go. And then you fully release your bladder. It should be 10 full seconds. That is organ number 1. It sits in the front of your pelvic floor. Then we have organ number 2, your uterus and cervix. So this is where babies grow up here in your uterus for 9 months. This is your cervix. This is really heavy, and that sits on the front half of your pelvic floor. If you stick a 10-pound baby in here, that gets even heavier. The weight of this on your pelvic floor makes the muscles weak. The hormones during pregnancy sends relaxin hormone to the muscles, and that makes them weak and looser. And that is all associated with a weak pelvic floor. That's organ number 2. Organ number 3 is your rectum. It sits in the back. If you have any complications, IBS, constipation, irritable bowel syndrome, that'll make the muscles of the pelvic floor get tight because they protect the organs that this sits on top of. So if this is irritated, the muscles will get super tight around it, and that will be associated with a tight pelvic floor. It can lead to tailbone pain, scrotal pain in men. So that is there in the back. If you go to the actual pelvic anatomy, you have your pubic bone in the front. Your pubic symphysis is the cartilage that is right in between. You have your clitoral hood. You have your urethra, which is the hole that you pee out of, your vaginal opening, your perineal body, which is the muscles in between the vaginal opening and the anus. And then you have your levator ani muscle, which is Latin for elevates the anus, and that's exactly what that muscle does. Your bulbospongius muscle is up at the top. So those are the muscles when you're doing a Kegel exercise. I'm sure you've heard of that. That you're actually contracting. It's the muscles of your pelvic floor.
So when we're contracting, what exactly is happening with the contraction of the Kegel muscles?
That's a great question. So if pretend you're going to the bathroom and you had to stop your flow of urine, you would actually take these muscles of the pelvic floor. To make it simple, I won't name all of them, but levator ani, bulbospongius are the 2 that we just went over. You would contract them, try to stop your flow of urine, hold it, and then release it. That is a Kegel exercise. So we give Kegel exercises when there is pelvic floor weakness, not when there is pelvic floor tightness, because if you're already tight and you're working on making your muscles tighter, you're going to make yourself worse. So that's why you actually have to consult a pelvic floor physical therapist for a full pelvic exam, because how do you know if you're weak or tight? Or you might have a mixed pelvic floor, and you might be a little bit of both.
So if you're tight, then what are we doing to make you less tight?
The opposite. So you're not going to be doing exercises to contract your pelvic floor. You're actually going to be doing stretches and breathing relaxation techniques. So there's certain breathing exercises we would give you. There's stretches that open up the pelvic floor, like happy baby and child's pose and diaphragmatic breathing, to help open up the muscles, oxygenate the pelvic floor, and help it to relax. Yeah. I know. Isn't this interesting?
It's very interesting.
Yeah.
Cool, I mean, right? But the basket, the sling, I mean, to see that visual, I didn't have, and I think probably there are a lot of people, and I'm a trainer, but I would never consider that there is a hammock or a basket or
the muscular hammock.
I even think purse.
A purse.
I think purse.
Yeah, your pelvic purse. Yeah. Anyway,
but yeah, that okay. So,
and the reason I go through all of this is because people don't really associate the organs with the floor. If there's a problem with your rectum, like constipation, it's gonna affect the floor. If you're having a baby, it's gonna affect the floor because it could make it weak or tight based on the symptoms of what's happening internally. If you have IBS or a UTI, which is a urinary tract infection, it could make your pelvic floor muscles tight as well because they're protecting the bladder and the organ, and then they get tight. So you need to get them to relax. You need to get them to open up. You obviously need to fix the medical problem with a medical doctor and medication. And then you have to fix the secondary, which is the muscles with the physical therapist.
So how long can it take to resolve this type of complication?
It depends how long you've had it. So if it's more of a chronic issue and you've had it for longer, it takes longer to treat it. If you haven't had it very long, you go see me right away. It's pretty quick to fix. Okay. So we usually have people come in twice a week for 6 weeks to start. We reevaluate, and then we usually have them come in for about 4 more weeks, and then we wean them out. So minimum of 12 visits twice a week for 6 weeks is what I would plan on. And then sometimes you need more. So you can fix this in 6 quick weeks.
Okay, so then if you can fix this in 6 weeks, I assume that you need a referral by a doctor, or can someone just show up?
Yeah, so it depends on your insurance. We do take direct access in Massachusetts, so you don't always need a referral from your doctor, from your physician. It depends. But if you call our office, or if you go onto Google and you go type in Boston Health and Wellness, you can get on our website. There's a green rectangular button. You click book your appointment. And then you fill out your information. It'll send it to my front desk and my billing team. They'll run your insurance and see what you need, and they will let you know. Or you can call our front desk, 617-843-5320, and talk to Erica, and she will get you in and let you know if you need a referral, if you don't. Typically, if you have an HMO, you do need a referral. If you have a PPO, you do not need a referral. It's the rule of thumb.
Okay, and then I have one slight aside.
Sure.
Now, something like this is a very sensitive topic. It's a sensitive nature. So my question is, do you have, and you'll see that, but my understanding is you have a room for privacy so that you can do the pelvic exams.
That's right.
And a person doesn't have to worry about a lack of privacy. I just wanted to bring that up because that's come to me.
Yeah, we actually have 2 private rooms at our Stoneham location.
Okay.
And you'll be alone one-on-one with a female doctor of physical therapy. There's a history portion. There's an educational portion where we actually have the model and explain what we're doing before we do it.
Okay.
There is a pelvic exam. So we step out, we'll do the pelvic exam when we come back in, and then we will do the treatment afterwards. So it's about an hour. Wear comfortable clothing, bring your insurance card, and we'll get you in and out in an hour, and you'll be feeling great.
All right. So then how can they reach you? How do we find you?
Yeah. So just like I said, Google Boston Health and Wellness, go on our website, click the button, or call our front desk.
Okay.
And we will get you in as early as the following week. A lot of pelvic floor physical therapy locations have a 2-month wait list, and a lot of them do not take health insurance. For various reasons. We are trying to streamline that process. As a female business owner, I don't think it's fair that you can have surgery on your shoulder and then go to physical therapy and it's paid for through insurance. But if you have a baby out of your pelvic floor, why is that not covered? So I'm trying to create a way, which we have done. So physical therapy to the pelvic floor is now covered by insurance.
Awesome.
And you are able to get in the next week.
That's fantastic.
And not wait 2 months and pay $200 a visit out of pocket to go into Boston.
I love it.
Awesome.
Thank you.
Thank you
So much
this
for
was so much
explaining.
fun.
I mean, thank you for explaining, because I've been wanting you for a while now.
Yeah, I know. Well, I watch all your stuff.
It's been, I mean, but same here, like you post, but again, for my clients out there and for the clients who need you, now you're here, you've shown up.
Right.
And, reach out to her. Whatever you need. If you need something from me, reach out to me. If you have questions, if there's something I can answer for you, a resource that you need, I am here for you. Thank you for joining me. And if you need anything, again, I'm here. My information's here. It's here. It's everywhere.
That's great.
And come back and see me again. Just a reminder, there is a workout that goes along with this particular show, this episode. So feel free to stay for that. But otherwise, I'm Laura Williamson. I'm your host. This is Bare Fitness. Thank you for joining me. And I'm going to see you next time. Bye.
Bye. Thanks.